the first major reason for radiology lawsuits is simply just misfindings, and there's no question about that. But actually, number two is a failure of communication results to the provider and to the patient. So one of the things we want to do with closing the loop is have better patient care, because we're making sure that patients don't fall through the cracks and get the studies they want. Conversely, when they do fall through the cracks, that opens up possible litigation. And in fact, we've seen that even here in our network. And so if we can decrease the amount of patients that falls through the cracks, we're also decreasing the possibility for those bad outcomes simply because there was no follow-up. Our collaboration with Within Health was predicated on, we wanted a system that was as automated as possible in terms of notifying patients for follow-up, because we didn't really have resources for a dedicated nurse navigator. I think in the marketplace, there are several options out there, but all of them require a nurse navigator to oversee it. We wanted something that was from day to day automated, that would run and run reliably. With everything, there's always bumps in the road when you're implementing new technology, but with a combination of our PACS team, which is strong, and the vendor of Within Health providing the support, we're able to overcome this. Now, there are always things that we always have to overcome, but the key is having a relationship where we can discuss it and then implement those things in real time, and that's what we've seen. We actually have a control arm and an intervention arm, where we have a group of patients that do not get the notifications, and at the same time also have a group of patients that are getting these notifications. And while this is ongoing, at last count, we're showing about a 25% improvement in follow-up studies for the patients that are receiving notifications. So we're seeing even greater benefits right now than we did before, but we still have a ways to go to see how this is going to turn out. As we progress from a fee-for-service to a more value-based quality payment system, it's going to be upon networks to really take the lead in decreasing expenses. So how might that decrease expenses? Well, when we have less patients fall through the cracks and get the follow-up studies, we may find findings that actually can be treatable or managed by the physician. Had we not taken care of that and that lingered, that could lead to adverse outcomes, which may result in more ED visits, depending on what we're talking about, or more inpatient visits. So as we go to more value-based payment system, we become cost centers. And if we can avoid the expense of an expensive ED visit or expensive inpatient stay because we took better proactive care of a patient, then we're actually saving dollars, and that's just as good as increasing revenue.